Good evening, all. So, in our day-to-day practice, we come across with many people who comes to us that they're sleep deprived or they're not getting sleep since many days. So, let us know about sleep today. Sleep is a wonderful gift from God, and sleep is very crucial. The moment you get to know the importance of sleep, you will definitely do not ignore the sleep, or you will make sure that you will put yourself to sleep, leaving all your work and maintain sleep hygiene. So, what are the benefits of the sleep and what are the stages of sleep? So let us know the stages of sleep. Stages of sleep are NREM sleep and REM sleep. So these two stages, they in an alternate cycle of 90 minutes throughout the night, this keeps happening. So NREM sleep is a deep sleep. REM, as the name itself indicates, it's a rapid eye movement sleep. So REM sleep is also known as a dream sleep. So that's when this is the stage where humans get more of dreams. NREM stage 1, stage 2, stage 3, and stage 4. And stage 3 and stage 4 of NREM sleep are the deep sleep. So, sleep is very crucial for human beings. So, what are the recommended hours of sleep? For an infant, for a child, pediatric age groups, up to 14 hours. So, but the same thing for the teenagers, it's up to 10 hours. But the adults and then elderly, it is about 8 hours. So, this is very, about 7 to 8 hours. This is very crucial for a normal brain functioning. So, let us know what are the benefits of sleep. So we often we would have often seen some of the students coming with the sleep deprivation associated some memory disturbances, learning disturbances. So this shows that sleep is helping us to learn better. So what happens when the person goes to sleep? The whatever the student would have learned, studied, that information is consolidated from the hippocampus. It is consolidated from the short memory to long-term memory during sleep. So it helps in learning. It also helps in creativity. A sound sleep helps in improving the creativity. Third thing, it also helps in emotional stability. So we have amygdala, a structure which is under the control of prefrontal cortex. So, with this lack of sleep or the sleep deprivation, the control is lost. So, the amygdala, so in turn, it doesn't have any control from the prefrontal cortex, and that's how its the disturbances or functions gets affected, and that's how it affects the emotional stability of a person. So apart from that, it is also there are some studies which shows that with the prolonged sleep deprivation, the testicular size goes on decreasing and it affects the male fertility. So sleep is very crucial for the fertility as well. And there are also studies which shows that sleep deprivation causes more of ischemic heart disease or heart attacks or more of strokes. So apart from that, there are so many psychiatric disorders like anxiety, depression, bipolar disorders are associated with the prolonged sleep deprivations. So with this, we know that sleep is very crucial for normal brain functioning. So how do you? I would. There is something known as a circadian rhythm. So circadian rhythm is nothing but a nature's alarm. So it needs a melatonin. So during the day, the man is awake. During the night, man goes to sleep when it is dark. This is nature's rule. So melatonin is a hormone which is very essential to induce sleep. So what happens when the circadian rhythm is affected with a jet lag or with any what to say the sleep pattern changes? So that also causes sleep deprivations. So it's very important to maintain a sleep hygiene. So what is sleep hygiene? Going to bed and getting up from the sleep should be fixed 365 days. So, if that is fixed, then usually it'll take some few days to organize or to maintain the discipline. But once it is maintained, so automatically you will go to sleep at so and so hours. Preferably avoid gadgets or systems or anything like that during when you're going to sleep. Avoid negative thinking. Avoid stressful thoughts which will disturb your sleep when you're going to sleep. So let me give you some few tips how to have a sound sleep before you choose for a sleeping pills. So first thing is, I would suggest always make sure that you maintain sleep hygiene. As I said, fix your timings. Second, there are some studies which shows that low room temperatures, when the room temperatures or the bedroom temperature is low, that induces a sound sleep. So the same concept holds good. Like most of us prefer to sleep more during the winter when it is cold. So the same thing applies here. So make sure that your room temperature is low. You can reduce your AC temperature, and then you can ask, once you go to sleep, you can ask one of your family member to regulate it thereafter. So third thing, you what you can do is, you in a dim light, make sure that you keep reading some books till you get asleep in a living room, not in a bedroom. So you can practice that. When you start reading some books in the dim light, you get to, after a while, you start getting spontaneously some, you start feeling drowsy. So that's how you can induce this method. You can try. Third, fourth thing is, so exertion, physical exertion is very important. The same thing holds good when we go for a trekking, or the day when we are too exhausted physically, that day will have a good sound sleep. So similarly, you can just apply that after a dinner. You can just go for a walk, some brisk walk, and then come back and go to sleep. Fifth thing is, you can have a hot water bath before going to bed. That you can try. So what happens? What is the concept behind this? Is with a hot water bath or any lukewarm water bath, when you take a bath just before going to bed, so your outside temperature is more, so the core temperature reduces. When the core temperature reduces, that also induces sleep. So sixth is, avoid cell phones or keep them away. Avoid gadgets or any system lights before going to bed. So make sure you have some soothing music, maintain some silence, soothing music before going to bed. So these are the things which you can try before going to sleep. So with all these methods, naturally any person would get to sleep. But also make sure that you avoid daytime sleeping. Many of us as elders, it comes to us saying that they are not getting sleep. If you take a history, we will get to know that they're not sleeping only because they have a habit of sleeping during the day. So when you do this, obviously they don't get a sleep in the night, because during the day we have to be awake. That's when the sleep pressure is maintained, and this sleep pressure is very crucial to induce sleep in the night. When you are relaxed during the morning and you are having enough sleep in the morning during the day hours itself, then obviously there are chances to have a less sleep or sleep deprivation or stay awake during the night. So avoid daytime sleeping habits. So with this, you can have a sound sleep. So apart from that, there are some mattresses or the bed what you use. You just check for it once. If it is too hard, discomfort, it's causing some discomfort. That also may be the reason which may be causing some pain, spasms, pain, and that may be affecting your sleep. So by practicing all this, naturally you will get a sound sleep. Despite all this, if at all you're not getting sleep, there are other things, like there are some medicines which causes, what to say, sleep deprivation. Apart from that, there are some medicines like diuretics. During the night when you take, there are chances of going to frequent micturations, nocturnal micturations, that is frequent micturations during the night. So make sure that you avoid such medications, or avoid it during the night, so that you will have a sound sleep, so that you don't have to get up in the night frequently. And for the diabetics, or for those who haven't frequent nocturnal micturations, we would also suggest to have less water intake or liquid intake after 6 p.m., so that their bladder is reasonably empty and they don't feel like getting up to pass urine during the night. So these are the tips which can be tried to avoid sleep deprivation during the night. Despite all this, if at all a person is not getting a sleep, then I think that is the time when you need to consult and then take some suggestions from your family physician or neurologist. So we would prefer, first thing is melatonin, a simple thing which will just trigger the sleep for a week or so, or for 2 weeks. And if this is also not working, then we would prefer some other medications for a short while to induce sleep. Just make sure that you practice or change all this adapt all these good habits, whatever I have given, all these instructions, the tips, before opting for a sleeping pills.